Hello, I'm Alan Pan, and I'm a data scientist with the Center for Outcomes Research at Houston Methodist. The focus of this presentation will be to give an overview of and share initial findings from the Bayou Greenways Health Impact Study, which is a collaborative effort our team has been involved in with the Houston Parks Board. So as a brief intro, Bayou Greenways 2020 is an initiative by the Houston Parks Board aimed at developing and maintaining upwards of 150 miles of trails or greenways, as well as other parks and open access green space. And really the goal is to connect Houstonians with opportunities for better health and wellness, as well as opportunities for better urban and social cohesion. So our study has three planned phases. We're currently in phase one, where our intent is to evaluate the health benefits that may be associated with the greenways. Phase 2 and 3 will focus more on evaluating the recreational use value of the trails, as well as other impacts on healthcare costs. So as mentioned in phase 1, the underlying hypothesis we're trying to investigate is whether increased exposure to nature and green space is associated with decreased adverse health events. And so to measure our outcome, we used inpatient hospital data to derive admission rates at the zip code level. For the purposes of this project, we're mostly focused on cardiometabolic outcomes, but we did identify a few cancers to study in exploratory capacity. And although not yet included in this phase of the study, we have considered mental health outcomes for future analyses as well. So although the Bayou Greenways contribution is our main exposure of interest, we are also interested in patterns from secondary exposures. So one of the factors that we have data for is a walk score for each of the zip codes. And what the score represents is really a measure of the ease with which one can walk to access different amenities. So a lower score essentially means that a car might be necessary to get around, while a higher score means that you can take care of most of your errands on foot. So our intent is really to treat this factor as a behavioral proxy for how likely it might be for someone to access the greenways. As a preliminary analysis, we did compare admission rates against walk scores in Harris County. And so we did end up seeing a signal for a handful of health outcomes, those shown here in bold, and we can also visualize those trends. So the way we've interpreted this is that areas with a higher average walk score tend to see lower admission rates for these particular outcomes. And so we're really just showing these findings here as an example of other factors that we can look at in addition to the greenways. But for this presentation, I do want to focus my time on how we've been exploring the greenways data. So to do this, we've been working with the Houston Parks Board to abstract different estimates of the greenways at the zip code level. Attributes such as trail mileage, points of access, estimates for the service area population. And so with this data, we've been able to derive three measures that we thought might each characterize a different feature of the greenway. And we have those summarized as exposure, accessibility, and walk proximity. So the first measure of exposure is best characterized as a measure of the duration of exposure. In other words, how long public use of these greenways has been available. And the reason we chose to look at it this way is because we want to relate this exposure to our fixed set of health outcomes from 2015 to 2019. So in this example, if we say that for a particular zip code, 2016 is the year that the greenway became largely available for public use, then 2016 effectively becomes our first year of exposure. And we would then characterize the outcomes for 2016 as having occurred with up to 1 year of exposure. The 2018 outcomes would reflect up to 3 years of exposure. In this example, since the 2015 outcomes occurred prior to the greenway being considered available, we would actually characterize this as a no exposure year, and we could then actually use this data as a baseline comparison. So with this framework in mind, we can take a look at what we saw from a sampling of data from 14 zip codes that the Houston Parks Board was able to share with us so far. So each of these points represents a zip code in a particular year, and it's a plot of the admission rates on the y-axis versus the duration of exposure on the x-axis. So here we're showing just a selection of outcomes that so far exhibited decreasing trends in admission rates over time, and you can see namely cardiometabolic outcomes. But as we get more data, it'll remain to be seen whether we'll see an actual dose response. But one initial takeaway seems to be that any exposure does seem to make a difference in average admission rates when compared to no exposure. So here we're just showing an example of another way that we can visualize the trends using heat maps. So these data are for ischemic heart disease, and the zip codes you see outlined in blue represent the 14 sample zip codes represented in that correlation plot to the left. And we have one more example for diabetes as well. So as mentioned, just a different way that we can visualize these trends. So it is important to know that these 14 sample zip codes do represent zip codes in which the Greenway directly intersects. For context, of the roughly 150 residential zip codes in Harris County, there are upwards of 50 that have a Greenway directly intersecting, and those are shown here in blue. So even though we were able to see an initial signal for these 14 zip codes, we recognize it would be valuable to compare this against zip codes that do not have any direct association with the Greenways, essentially a comparison group. So when we did look at the nearly 100 zip codes in Harris County without Greenways, this is what we saw. So these density plots show the distribution of admission rates by zip code, with the blue line representing the trend across the conditional means. So we can see that over the course of 5 years, many of the same outcomes shown previously do exhibit no change in admission rates here. And we can even see for diabetes that the rate actually increases. Breast and prostate cancer rates did decrease, so it'll remain to be seen whether this is because onset and development of cancers may be impacted by other factors over a longer period of time, rather than the shorter five-year range that we're looking at here. So while this is so far just a descriptive comparison, a potential takeaway that we can seek to further validate is that, in contrast to zip codes without Greenways, zip codes with Greenways may see some signal of benefit for particular health outcomes, such as heart disease and diabetes. So while we don't have enough data yet to present any meaningful findings for accessibility and walk proximity, I do want to briefly touch on the methodology that we use to derive these two measures. So for accessibility, we relied on the team at the Houston Parks Board to identify for us points of access onto the trails. And here we're defining primary access points as, for example, an actual man-made or concrete path onto the trails. Whereas an example of secondary access might be if you can cross onto the trail through an open grass field or a commonly used footpath. So using the number of access points as well as the length of each of the trails, we derived a measure for the number of access points per linear mile. Doing so just really gives us a more standardized measure that we can compare across zip codes. So for example, this map shows a section of the White Oak Trail, and you can see how and where the access points are being designated. The graph on the right shows the distribution across the sample zip codes. And we do want to note that these calculations will be refined in our next iteration of the data in order to more distinctly measure changes in access from year to year. But at the least in this example, we are seeing quite a variable distribution. So going as low as 1 access point per mile to as high as 12 access points per mile. So the hypothesis that we'll look to test will be whether areas with higher average access may see more of a health benefit. Lastly, walk proximity we have defined as the proportion of the zip code population that resides within a 10-minute walk of the trail access points. The Houston Parks Board team has been able to leverage geomapping tools to provide for us these estimates. So in this map, you can see the designation of the access points that you saw earlier, and now the area in orange represents the 10-minute walk buffer. And these calculations do take into account more than just distance. So factors such as obstructions or whether or not sidewalks are available. So it's a fairly robust calculation. Using this buffer, we're able to abstract estimates for the population that lives within the service area. And so similar to our measure for accessibility, one hypothesis that we might be able to test will be the higher the population proportion that lives within a 10-minute walk, the greater the average health benefits. Finally, I want to briefly preview the direction that we hope to take our analyses and our modeling. So as mentioned, the Bayou Greenways contribution is our main exposure or interest. And so far, we do have 3 ways that we think we can characterize that, being exposure, accessibility, and walk proximity. But we do want to evaluate the effects on health outcomes while adjusting for other covariates. In other words, while taking other factors into consideration. So we do intend to include the walk score that we showed data for earlier. We also have population and socioeconomic measures that we think will be useful as well. And we are also exploring different environmental measures such as air and water quality, as well as measures of greenness, possibly using an NDVI approach. So as we get closer to a fuller set of data, we'll be able to put together a clear picture of how all these factors might be related. So that concludes this overview of where we stand with the study so far. Before I end, I do want to make sure to acknowledge our team members from the Center for Outcomes Research. Dr. Bridget Simon-Fried is our postdoc who's been leading our research efforts. Tarek Nassar, our biostatistician, who's handled our analyses. And we've been able to do all this under the guidance of Dr. Nasir, Dr. Maddock, and Dr. Kesh. From the Houston Parks Board, Amanda Nunley has been a big help in working to provide us with the Greenways data. And thank you as well to Lisa Grafe, Trent Rondeau, Richard McNamara, and Beth White for their project insights as well. Thank you for your time.